Welcome back to Raw, the podcast. I'm your host, Allie, founder of the Cheeky Clean, a wellness brand empowering conscious consuming. And I'm honored to be here and welcome my guest today, Dr. Madison LaGard.
Hi.
Hi, welcome, girl.
Thank you. I'm so excited to be here.
So excited to have you here. Madison is a functional medicine doctor with Great Lakes Health and Wellness here in the local area. Actually, that's a good question. So most of the things you do on virtual. So do you have patients from all over or is it mostly local?
I do. Most of my patients are local. I do have patients out of state, which is we're starting to branch out a little bit.
Yeah,
Which is
cool.
nice, but
Yeah.
a lot of my patients are Northeast Ohio area.
Yeah. But that's cool in this day and age with the virtual vibe. You can really expand to anyone who's interested in connecting with you.
It's so nice. It's so accessible. You can take my calls from your bed, from your car, as long as you're not driving. But it's really nice and accessible.
Is all of it virtual?
All of it's virtual.
Wow.
Yeah.
That's really cool. I didn't realize that.
Yeah.
Well, thank you for being here today. Dr. Madison. I always call you Dr. Madison.
No, that's what I go by. That is what I go by. I hear Dr. M, Dr. LaGard. I'm like, whatever you want to call me.
Okay. Cool.
Yeah.
Because we met at a panel that we both did, kind of like a health and wellness event at Bloom Social House. I want to say about a year ago.
Yeah.
I think it was like July last year. Oh my gosh, how cool. And we were both on the panel kind of being asked different questions, and I was super inspired by you. And I was just like, wow, you are a wealth of knowledge. All the answers that you provided, so thorough. I could tell that your background was quite extensive and that you really took care and intuition in the way that you were approaching not only the community with the information that you were sharing, but also your patients. And so it was a pleasure to meet you then. And since I have a lot of people in my cheeky community ask me about functional medicine, regular doctors in general, I think it's such an area for consumers, humans in general, where we really are lacking or hungry for that quality care.
Absolutely.
And so I've recommended you so many times to different people, and I have friends that go to you. I'm going to go to you. So it's nice to actually sit down and talk further. And I should have asked you sooner, but the podcast got going. And then when I was doing one on actual healthcare, I'm like, all right, I'm manifesting Dr. Madison to come on. And you're like,
speak it into the universe.
So it's so cool to have you here. And for those who are listening, this is the Dr. Madison that I spoke about in a few episodes ago. So just manifest your dreams.
It's real.
Totally. But no, thank you for being here. Functional medicine in Cleveland, which you were telling me that you're not from here. So you've been in Cleveland how long?
It'll be 2 years. I guess this summer, 2 years.
Okay.
Yeah, so
2 years.
new.
Got it. Yeah. Relatively new in general. And I'm curious to hear your thoughts on just like the overall health of the people in the Midwest. But I think leaving and moving to California, where I lived for 6 years, is what really opened my eyes. Not only was I in the chemical industry, and so I was selling ingredients to an area of the country where the regulations were so different, but then I also noticed how different the culture was around health and more of a natural approach. Even the doctor that I was going to out there kind of like teetered on, even though it was with my regular insurance doctor, like she teetered on being much more holistic and recommending different things, even though I couldn't always go through her, recommending different functional type things to get a better overall view of what was going on with my health and for prevention and longevity, which is really what I'm passionate about.
Absolutely.
And when I moved back, I think is when I really saw how stark the difference is and how it's not that we don't have the access here, it's just less common. And I think we're still at like the tip of realizing how much our lifestyle and the systems that we've always trusted in aren't serving us long term as much as we thought they were.
Yeah. Totally agree.
Yeah.
Totally agree. I think living and growing up on the East Coast, people were healthier. They were relatively more active, but really moving to the Midwest, we don't get sunlight. People really don't move around as often as they should. It's just a pretty stark difference when it comes to where you're living in the country, but also the providers that are available. My one doctorate degree, my naturopathic degree, technically I'm not a physician in the state. In California, West Coast, I can prescribe medications, not that I want
Oh,
to. I
wow.
can do minor surgeries. I'm a full scope physician, but here I'm not even recognized as a doctor unless I have some other degree. So it really depends on where you're
That's so
living.
interesting.
Yeah.
So it's a bi-state thing.
It's a by state. And I want to say there's 26 or 27 states where naturopathic doctors are licensed. They can practice on their own. Every state is different.
Mm,
Some states, full scope of prescription rights. Some states, like I mentioned, not at all. It just depends on where you're at.
That's so wild.
Yeah. Yeah.
So it really does kind of encourage
Mhm.
the more standard approach.
Absolutely.
Yeah.
Absolutely.
Where functional medicine started to create buzz in Cleveland is because Dr. Mark Hyman
Yep.
started the functional medicine clinic at the
Mhm.
Cleveland Clinic,
Mhm.
which was groundbreaking in this area completely. And I think still to this day, people are still curious about it.
Mhm.
The challenging part is it is so hard to get in there. I mean, I'm talking a year out.
A year out, I see patients that are like, they're not even putting me on the wait list because
Yeah.
it's so far out, or I can't follow up with my doctor.
Yeah.
I'm on these supplements. There's still things going on. So I get a lot of patients who are just kind of a number. They're in this weird mix and they're still on their health journey, but they want answers. They want someone who's accessible and
Yes.
I mean, good for them. They've grown so big, but that's also part of the problem is people are looking for functional medicine and they can't get it around here.
Can't get it. Exactly.
Yeah.
And so that's where it's like a great first step. But I think to your exact point, the accessibility has still been so limited until recently and
Mhm.
more private practices like yourself. I think there's a bit of a misconception that if you go to the Cleveland Clinic, functional medicine clinic, that you are automatically having insurance cover all of it.
Mhm.
And that's not the case at all.
Yeah.
It's a very similar dynamic with it being not covered under insurance.
Yeah.
And so you're waiting that long, you're not having the accessibility, and you're still going to be paying
Right.
and investing in the same way that you would in a private practice.
If not more.
If not more. And so it's important to me, I think, to highlight yourself and those in our community who really have dedicated their lives to helping us learn how to live healthier and what's available to learn more about our bodies and our health because the standard healthcare system is so limited.
So limited. This is kind of side note. My mom's a nurse, so
Okay.
I've had a lot of healthcare education growing
Yeah.
up. I have a twin sister. She's a medical doctor.
Oh,
Her husband's a
wow.
medical doctor. So I hear it from them. Now they're more surgical side, but I hear it from them and their patients and how sick people are. And it's so limited. We don't really get that in between. It's either you're sick or you're not.
Mm.
And really, that's where a lot of people fall into the cracks is I don't have access to care and I don't know where to go. I'm not really sick, but I also want to prevent. And that's where a lot of people struggle and don't have that care that they need.
Absolutely.
Yeah.
So what drove you into this more natural approach, kind of having had that exposure to the standard
Yeah.
route?
Yep.
What brought you here?
I kind of, long story short, suffered from concussions growing up. I was in competitive cheerleading, led to migraines 20 plus a month.
Oh my gosh.
Yeah. I was 16 on antidepressants, blood pressure meds,
Mm.
anything and everything that neurologists would throw at me, still never got rid of my migraines. I knew I wanted to be in healthcare. I knew I wanted to help people, but didn't really know what was out there. So when I got to college and undergrad, I enrolled in pre-OT, just regular occupational therapy. And my first freshman seminar class, it was an alternative healthcare class. And I was like, I don't even know what this is. This is probably a bunch of woo-woo stuff.
Yeah. Yeah.
And my first class, I remember my professor saying something about naturopathic medicine. It's like, what is that? It's supplements, it's diet, it's foundational things. I've never heard of this before. So I went home, remember Googling and calling my mom. This was like the first week of college. Like, I think I want to change my path already. And she was like, all right, let's do it.
Amazing.
Yeah.
So you were just so intrigued.
I was so intrigued. I knew there were more answers out there because I was a patient on that side where I was just frustrated. I didn't want to take a pill to get rid of my migraines. And if I forgot my pills, I would be debilitating in bed and not be able to function. So I've been there as a patient multiple different times and it was frustrating for me at a young age. And I figured there had to have been another route.
Wow, that's so interesting. It's
Yeah.
crazy because whether it's a founder, a provider, anyone who's kind of dedicated their purpose career-wise to these types of healthier wellness living industries, It's always because of a personal experience,
Always.
like clockwork.
Always. All of my friends in school either had career changes, had an aha moment. It wasn't just I fell into it because that was the path that X, Y, and Z, whoever told me to go. It was always some kind of personal story.
Mhm.
That's usually how it goes.
It is. It's so interesting. And I can imagine it's almost like the opposite of the standard kind of safe path
Right.
when it comes to knowing you want to be in medicine. You know, you know the exact route that you go to do standard medicine.
Yep.
This is definitely more of a gamble.
Yeah. I had to do a lot of researching. What programs were accredited? What states could I practice in? It was, well, you could come out of school and really be ridiculed and maybe not even practice. It's one of those things that it is not a safe option, but really people that get into this field are passionate about it. Usually they
Absolutely.
continue on and see patients and do their own thing, but it's definitely not the safe route at all.
No.
At all.
And I think
Mhm.
that's what makes it really powerful, and where oftentimes we are lacking in the standard healthcare system, conventional healthcare system, is it is less about the doctor's ability to really be personally invested and provide that personal care. It's more about assuring that they're in line with that system and that cookie cutter approach, because that's the way the system is set up.
Yep.
That's how insurance backs it.
Yep.
It's just is what it is.
Mhm.
And it's the same way I feel about brands that we support in the grocery store.
Yeah.
It's, you know, when you have an entrepreneur who created something out of heart, it's a very different approach and a different product that's the outcome than when you have one that's big brand reducing their quality over the years, just following suit with the norms and the regulations in our country, which, as we all know, talking more about food that aren't necessarily serving us. So it's powerful. And what's even more powerful is that in the same way you've come and many have come to this type of alternative healthcare because of a personal experience, most often people are probably coming to you from the same.
Absolutely.
Yeah.
They're usually coming to me as a last resort.
Yeah.
Usually I get people when they're at their lowest. I don't know where else to go. I just don't have any answers. So they're vulnerable. I mean, like I said, I've been there on a patient side multiple times. I know what patients are going through, and it's frustrating and it's tough, but I want to provide that space for people to just talk. Just tell me everything about you, and I will do my best to work with you and figure out what's going on. That's my ultimate goal, is to change people's lives in that way.
Yeah. And it's taking the root cause method versus the specialist approach, try all these different medications, see what works, see what side effects you get kind of thing, which is, I mean, it's so powerful, and you're a lifeline for so many. And I think what I really hope to inspire today with our conversation is people who will consider functional medicine before it's a last resort as preventative care, longevity, an option to have yourself as a doctor, not before you have an autoimmune disorder or a hormone issue that you're being passed around from doctor to doctor on.
Yeah, that's how it should be. I mean, functional medicine in general should be that first step, but it's flipped all backwards, where it's, like you said, it's a last resort, and it's frustrating, but it's not anyone's fault. It's how the system is.
It is how it is, for sure. And I think even when you do find a good doctor in the standard conventional system, it is frustrating for them how oftentimes they're tied with the care that they can provide.
Right.
So it's knowing that we have these options and how to access them, which is such a powerful thing. I'm curious. And so you said 2 doctorates. Naturopathic.
Naturopathic, and then my second doctorate is in chiropractic.
So, and what was the thought process there?
So, I because I did a lot of research going to school, I knew wherever I was going to end up practicing, I might not be licensed. So, essentially what that means is if I just had that naturopathic degree here, all I could do was serve as a health coach. Wouldn't be able to diagnose. Even though I have the pharmacology, the 4 years of training, the doctorate, I wouldn't be able to do those things with my patients. So I didn't want to be tied.
That's wildly interesting.
Yes. So really it comes down to politics and all of that. But the school I went to, National University in Chicago, they offered a dual degree. So if you basically combine your classes, you get a second doctorate in a year's time. So that allowed me to have full scope everywhere for the most part. But in the state, I can prescribe, or not prescribe, I can diagnose, I can do everything that I want to without feeling like I have my hands tied and I can't do the things that I need to do with my patients.
Yeah. And
Yeah.
chiropractic allowed you to kind of like fit that loophole.
Right. Right.
Are you practicing chiropractic care at all?
So out of our 3 offices, the Ohio City, Strongsville, and Westlake office, I'm a fill-in doctor. So I will adjust if someone's out. If a doctor's sick on vacation, I will be that stand-in physician. So mostly in functional medicine, but I will fill in where needed.
Yeah.
Yeah.
That's really interesting. So I want to talk a little bit about the differences and kind of what you think is missing in conventional healthcare, or maybe the way that you approach your patients that is unique compared to that standard approach, so that like someone who's never been to functional medicine before and they're like, well, why do I need it?
Right.
Might consider.
Right. So you mentioned root cause approach. So my job is to figure out why potentially you're having diseases or issues, symptoms, and or prevent them from happening. So that's my first step is, okay, talking to patients. One, usually appointment times for your normal primary care provider is 7 to 15 minutes max. My appointments are 30 minutes to an hour and a half, depending on what we're talking about, labs, all of that. The other part is I don't necessarily specialize. I work with the gut, hormones, I have cancer patients. If you see it in a primary care setting, I work with all of it. Just because the body is a whole human. I'm not just going to be like, let's take care of hormones, or I'll send you to a hormone specialist while we work on the gut. Everything is tied together. So it's nice to have a provider who does it all. Now, obviously, I will refer if need be, but it's nice to have someone who gets the whole picture versus bouncing around to other specialists, which again, you can fall through the cracks. Physicians aren't talking to each other, but also the prevention aspect, hey, let's clean up your diet, or how are you sleeping? I'm never going to tell you just lose weight and drink more water. Your anxiety, you're just overthinking. We work on the foundational things, because if we're not doing the foundational things, the sleep, the diet, the managing stress, a lot of disease processes start from that. So a lot of doctors don't mention, or they just say, hey, clean up your diet. They don't tell you how. What diet is good for me? What do I have to avoid? So those are a lot of things that I talk about with patients. And then other things is that I do is very thorough testing. Insurance and physicians won't run a lot of tests, or your insurance will be like, that issue's not even going on. We're not going to cover it. If you want it, or if it's in your family somewhere, or I think this might be contributing to your symptoms, I will order it. I'm not dictated by insurance. I can do what I want to with patients. And if someone's like, hey, I know there's a Dutch test or a mold test that I want, I'll order it. I have no problem doing that. So I'm not constrained by insurance. I can do what I need to with patients.
Absolutely.
And I just hear them out. And that creates a really cohesive kind of relationship with patients. And I would want that too. A provider that listens. And if I'm advocating for, hey, I think this is what might be going on, can you run these things? I want a provider that'll say, yeah, let's look into this.
Yeah, it's so interesting because those positives that you mentioned are exactly where the deficiencies are in the standard conventional system. And I think why people are probably at you from a last resort is because they've bounced around from specialist to specialist. The one specialist isn't able to pinpoint exactly what's going on because they don't have the visibility of everything else, and you're never able to get answers. And those unique things that you're testing for are becoming more and more common.
Yeah.
Mold toxicity, hormone issues. I mean, I first learned of functional medicine and became intrigued in clinics around here for alternative care when I was married and looking to start to conceive. It was like taking a longer than expected. In hindsight, I believe strongly that it was just divine timing.
Sure.
Now I'm divorced.
Sure. It works that way.
Everything happens for a reason. You can't force it.
Right.
But at the time, I just wanted to really understand, especially for, getting into my mid 30s, what is going on.
Right.
And am I good and able kind of situation? And it is so wild. And irregular periods, like there were some things going on where I'm like, okay, I feel like I need to see. And the normal blood work that my doctor gave me didn't even test for thyroid and hormones and like the basic things that would be needed to identify if one of those issues was going on. And so they're like, it's all good.
Right.
from their limited blood work, it's all good, which meant that I couldn't even get in with a hormone specialist because there wasn't an issue and
Right.
there wasn't a recommendation from my primary care physician. And I'm like, what in God's name?
Yep. I can't tell you how many times I see that. And or I run blood work or extra tests. I'm like, how did your doctor miss this?
Yeah.
Oh, it's because they didn't run complete panels. And I will be like, hey, this is what's going on with your patient. I just want you to be in the loop. And I get the nastiest emails from big hospital systems around here. I'm not going to name names, but they feel like it's stepping on toes. But it's like, well, if our system was working well,
Yeah,
this
then
wouldn't
we
be a
would
problem. Right?
exactly. And people are so sick and
Yeah.
they're getting to run around. I
Yep.
mean, and I think that I try to help people learn how to reduce their toxic load because there is no such thing as being completely clean when we're in
Right.
the environment that we're in. And it's everything from the homes to the products to, the way that our bodies are ingesting these toxins on a consistent basis that are driving a lot of the
Yeah.
immune disorders, hormone issues, endocrine disruptors. I mean, there's so much going on and none of it correlates with each other.
Right.
And so it's like as these norms of living in a toxic environment have gone up, the standards for that blood work have stayed the same. And so there's such a disconnect. And people are literally just spending so much time and money to get no answers.
Yeah.
And it's a shame.
It really is. It makes me sad for patients because I feel for them.
Yeah,
But I am happy that functional medicine is starting to become a bigger name
absolutely.
because people want answers.
Yeah.
Like you're saying,
Yeah.
people are sick.
Yeah.
Just a matter of figuring out who you belong with or who you can work with that
Yeah.
is reputable.
Yeah, exactly.
That's the big thing.
And that's probably the hardest part because, again, it is kind of this like new upcoming thing. And that's what I'm finding on the internet is a little bit scary.
You're telling me.
I can only imagine because you're an actual doctor, like seeing the things that anyone can call themselves a doctor.
And then it's backwards. I'm a doctor, but I can only call myself a health coach here. So it
It's
is
so wild.
bass backwards.
Yeah. And so
That's
it's
what
like
you want.
really being cognizant of who you're choosing and what their credentials are
Right.
and the care that they can provide.
Right.
Yeah.
Yeah.
Is huge.
Yeah.
Oh my gosh.
Scary.
It's super scary. Are there any kind of common things that you're seeing on a consistent basis? Like, is it a lot of hormone issues? Is that like a lot of what comes to you? Or like, what are, when you say last resort, what often are those, say, most common issues that you're seeing in this area?
Just for context, I see probably 98% of my patients are female just because they're more on top of symptoms and in their body. A majority of what I see is infertility, abnormal cycles where it's just like, just take the pill. Why wouldn't you just take the pill? And then they're like, well, I don't want to take the pill. And then they don't have answers. I see a lot of that. I see a lot of gut issues where they've done the colonoscopies, they've done X, Y, and Z, and they have dysbiosis or SIBO. And their doctor just is like, you have IBS. It's fine. I'm like,
Yes.
no, you actually have a microbiome issue. Those two are the biggest things that I see.
That makes sense.
Other things are like autoimmune conditions as well, because it's becoming a lot more prevalent with all the chemicals and all the stress and yeah.
Wow. And so are you mostly women and are they mostly like in our age range or does it vary?
Interesting, because I have a chunk that's in our age range, and then I also have a chunk that's like perimenopause, menopause.
Yeah.
Because a lot of women are like, I feel like crap, but I don't want to do the hormone replacement therapy. What do I do? So I have kind of two groups of people and a little bit in between, but it's really starting to realize what's going on with your body and like, okay, I'm starting to go through menopause kind of issues.
Yeah.
Yeah.
What age does perimenopause start typically? Because I feel like I'm 36 and I'm not far away from it.
So if you look this up online or do some research, perimenopause is a period of time where you can start seeing a shift in hormones, and that can be anywhere from 2 to 10 years. So some women are hitting perimenopause in their late 30s, early. So it depends on the person. I'm starting to see it a little earlier and earlier in people, but yeah, it's a wide range. It truly depends with people.
Yeah, that's something I really want to learn more about. I can't tell you how many of my friends are seriously suffering because they're having these symptoms. They're getting, even closer, some in menopause. And it's just like the lack of information and access and understanding of women's bodies as it comes to the standard medical system is really challenging.
Yeah.
And it's just kind of this like yo-yo of like, do this, try this, like
Right.
cluster.
Right. And it's really, women are not educated on the perimenopause,
Mm-mm.
menopause. We're told about this change is going to happen, but then you're already in it and you're like, well, shit, like,
Yes.
I don't feel well. Like, what do
Yeah.
I do about this? And then again, standard treatment is just do hormone replacement therapy. Some people don't respond well, or they have a history of cancer and they
Mhm.
can't. It puts people in a weird spot where it's like, okay, there has to be something else out there.
Absolutely.
Yeah.
I don't want to get too polarizing.
You're good. That's my life.
Like, you typically, like, if someone were to come to you with hormone issues
Mhm.
and they're on birth control, do you
Mhm.
usually end up recommending them go off of it?
So that's something you and I were talking briefly before. I'm here to educate both the good, the bad, the ugly.
Mm,
I will give you all the information on both sides.
got it.
It is my job to inform you enough to make a decision that works best for you. If you want to stay on, awesome. We'll figure out
Yeah.
how to support you in that process. And if you want to come off, cool. We can
Gotcha.
also support
So
you.
you
So
give the
I
options.
give the option. I'm not someone who's anti this, anti that.
Hmm.
Conventional medicine is absolutely necessary in cases, but I think that's where a lot of people see functional medicine providers or naturopaths and think that we're like full blown off the deep end.
Yeah.
Like, don't do any of this. But I fall somewhere in the middle of you might need this, and it
Yeah.
might be right for you at this point in time. It's
Mhm.
just a matter of does this make sense
Yeah.
for you?
Yeah. And if you are, then what does that lifestyle look like
Right.
in order to support it?
Right. Exactly.
And what foods and things
Yeah.
like that.
Right.
Yeah, and I think just women in general, it's so, perimenopause, menopause aside, I mean, even just our bodies, our cycles, it's like the whole health class
Mhm.
needs to get rewritten because we aren't taught shit about our bodies and our health.
Not at all.
And it's like, yeah, I mean, I had a doctor for bad cramps
Mhm.
as a teenager. Put me on birth control.
Yeah.
And that is absolutely
Oh,
insane.
yeah. I was put on birth control for acne.
I know.
And that's a majority of what women are put on for, and they stay on it for years, and then they come off of it and they're a wreck.
Yeah.
Not all the time, but it's
Yeah.
like, what
It's
is my body
such a
doing?
shift.
Yeah.
Yeah,
Yes.
it is. Yeah, I would say hormone issues are really common, and a lot of people like ask me questions about that as well. The other things that I get asked a lot about, and I'd be curious your thoughts on acne for sure,
Yep.
like you mentioned.
Yep.
I learned I used to get a lot of hormonal acne actually when I was on birth control, which is interesting. Since being off and like kind of clearing my body, I definitely notice it. And it was Kate who does my facials from Selfmaker, who sells a lot of really clean, amazing products over in Van Aken. When I first went to her, she was the first one who said, "Well, what are you doing for your gut?" And I was like, "What?"
Yeah.
And
Yeah.
she's like, "You're not breaking out from the products you're
Mhm.
putting on. It starts inside."
Yeah.
And I'm like, interesting.
Yep.
And when I started to really dial in on my gut health, both the foods I was eating and the supplements I was taking, my skin cleared up.
Yeah. Yeah. And I hear this all the time is I've been doing all these topicals, I've been doing all these things, and then my esthetician said, "Well, what else? What are you eating? What are you doing to your gut?" So
Yes.
I've been hearing that a lot lately, and
That's good.
usually when it comes to acne, okay, let's look at hormones, but majority of the time I do microbiome testing. A lot of times it has to do with just an imbalance there or something called leaky gut where the
Uh-huh.
body's just reacting. It's
Okay.
inflamed, it's causing acne. There is a lot of liver tied in as well, liver support that needs to be done. If you think of Accutane, Accutane is essentially it's a drug, but it helps turn over liver cells. Yeah.
Interesting.
Yeah. So it's just at a higher rate,
Yeah.
but a lot of that has to do with the liver
The
and
liver and what's
processing.
going on
Mhm.
inside. Wow,
Mhm.
that's so interesting. And it also is like no surprise that at the time I was drinking
Yeah.
and not living the
Mhm.
healthiest internally. I'm sure that has a lot to do with all of it.
Yeah.
The other thing is hair loss. That is like the number one thing that my personal age group is
Yep.
dealing with, like men and women, but mostly women. And I've actually asked Jen about it before because she's always like calling me crazy for saying that I'm losing my hair because she does my hair and she's like, "You have so much fucking hair, like you're fine."
Yeah. It's a lot on their head.
Like, but you don't
Yeah. Yeah.
see what I'm
What's coming up?
losing. And
Yeah.
like you can tell on the hairline that
Mhm.
it's changing. Is that a hormone thing?
Could be hormone, could be
Yeah.
gut, Could be stress.
Got
Could
it.
be if your body went through a really tough sickness, you can lose hair. It's a natural response, but it could be a lot of things. And again, that's where I come in and truly figure out, okay, what route do we go? Because
Uh-huh.
there's lots of ways. Potentially need to support your hormones, but also your gut. We just need to figure out what is causing your
Yeah.
hair loss in the first place.
Got it.
Yeah.
And then you take it from there. So
Yeah.
on a first time visit, what
Mhm.
can people expect from you?
So typically, first time visit, it's a 30-minute consultation, but I learn all about patients' concerns.
Mhm.
So, what's been going on? How long? What have you done already? What has worked? What has not? Any medications that you're currently taking? Things like that. So, it's really getting to know the patient
Mm.
to decide, oh, can I help you with this or not?
Mhm.
Majority of the time, I can.
Mhm.
But again, it's about being safe. If I
Mhm.
need to refer out, I will. But it's really figuring out, okay, what kind of testing do you need? What kind of potential treatment plan is that going to be? And patients will get all of that information during the first appointment. Hey, this is
Gotcha.
what I'm thinking. This is the testing that I want to do. This is where we're going to start.
Got it.
Yeah.
And then typically, what does that next phase look like?
Next phase would be I order blood work for most people. If it's older than 3, 4 months, I'll order it. So I work with Quest Diagnostics. I run very thorough blood work. And then sometimes, depending on the patient, I'll either do like hormone paneling, like a Dutch test, or a stool test, maybe more functional labs, depending on the case. And then we'll sit down on a lab review. So we'll go over everything very thoroughly,
Yeah.
an hour, hour and a half, and they'll also get their treatment plan during
Yeah.
that time.
Very interesting. One thing I noticed and learned, I haven't had my labs looked at by a functional doctor in years, so I'm definitely due. But at the time, what I found so interesting is it seemed like the range for what even the same things that a regular doctor would test for,
Yeah.
which they would say all good, they would tell me this is actually on the lower side,
Yes.
even though it would fall under that like typically fine
Mhm.
by the standard
Mhm.
range. You're on the lower side and you should probably be supplementing
Right.
to be more closer to center.
Right, right. And that's what I do is if you look at the reference ranges, they're for the most part, they're very wide, but it tries to group male, female of all ages in a textbook number. And that doesn't fit everybody. So I get very specific in terms of optimal or functional ranges. So I'll tell you, hey, Allie, your blood sugar needs to be 80, 85.
Yeah.
That's where I want you to be. And you're closer to 90. And we really need to look at that. So I'm very specific when it comes to lab work. I'm not just gonna be like, yeah, everything looks fine. Because usually you're leaning a little bit more towards one end and we want to keep our eye on it.
Yeah.
And blood work changes every 3 to 4 months. So I stay on top of it when I work with patients is I order blood work pretty consistently. Because if we're
Interesting.
working on
Yeah.
fixing and changing the body internally, I want to make sure that
We're
the labs are
seeing it.
changing as
Yeah.
well as your symptoms.
Yeah.
So I stay on top of labs.
Yeah.
And most functional providers do as well.
Uh-huh.
Just depends.
Got it. And so obviously the blood work and those type of tests can really help you see and then discuss with the patient what's going on from a root cause standpoint.
Mhm.
And then is it usually a lifestyle changes mixed with supplementing?
So it's dietary.
Okay.
Depending on the person, sometimes we need to eliminate things.
Mm.
It's lifestyle and it's supplementation. Really the supplementation is in addition to everything else we're doing. So I don't want someone thinking, oh, my supplements are going to take care of everything.
Yeah.
I want to focus on, hey, let's again fix the foundational things, and then we'll add the supplements in to help provide the last kind of oomph that we need in order to fix
Absolutely.
things. So that's in treatment plans, I give large documents. They're 10 pages long, but it's just information for people. Hey, let's educate you. If we're
Yeah.
going through this process, might as
Mhm.
well.
Mhm.
There's so much out there, misinformation.
Yeah.
I want to make sure that you're getting the correct information.
Totally. Yeah, the misinformation is hard for me. And I
Mhm.
think where I started to get frustrated because so the place that I went and got my labs done, they had recommended some supplements and they
Mhm.
had their own supplement line. And I'm versed in ingredients.
Right, right.
So I'm like, I just assumed and I went with what they said. And I bought the stuff and without knowing better, like I do,
Mhm.
without reading everything first. And then I got home and I'm looking at the back of it and I'm like, why is this filler and shit in these supplements?
Yeah.
And so then I realized just because they are versed in the type of supplements that I should be taking, which is absolutely correct.
Mhm.
They might not be as versed in the ingredient side of things. And that's an area that I do think is so ambiguous
Yeah.
because of supplement manufacturing and the gray areas that exist there. And so, again, what I loved about you is my close friend comes to you. She was like, yeah, Dr. Madison put me on these couple things. I would love if you look at the ingredients.
Yeah.
I'm like, love to.
Yeah.
I'm so excited.
Yeah.
And I was so impressed. They're all really clean,
Yeah.
really good products. I think that's what's so difficult is there's so many things to recommend out there.
Yeah.
There's so many brand affiliations. There's ways to collaborate and sponsor that, you know, when it comes to making money and stuff, that it's just so important to find a doctor that's not only going to provide the right holistic care, but then also provide recommendations for the right products that aren't going to cause more issues or be ineffective.
And I mean, I see it all the time is influencers, big name people, they're getting paid. There's a greens powder out there. It's a proprietary blend. It is, you're paying $100 a month for. What is really, what is the value in that? Not everybody needs it, but also we don't know what these ingredients are. If it's a proprietary blend, it just says 400 milligrams of all these ingredients. Is that a therapeutic dose?
Totally.
Probably not. So that matters just as much as supplements and quality of supplements. They're expensive, or they can be expensive.
Exactly.
And if you're wasting your time and money, like, what's the point?
What's the point?
Yeah.
For sure. I saw you posting something recently about supplements and medication, which is like, can you talk a little bit about that? Because I think like no one is.
Absolutely. Yeah.
And people think supplement equals plants.
Yeah.
And it's just like, you can have as many of them as you want, just like eating a salad.
Yes. And that's the problem is supplements are not FDA regulated, meaning anybody can grab anything off the shelf. Now, in schooling and in naturopathic medicine, functional medicine, we talk about pharmacology. So how do drugs interact with the body, but also how do these herbs, these vitamins, these minerals interact with those medications? A majority of people are on something. A majority of people. You could be taking any supplement off the shelf and essentially making your medication ineffective.
And not even realizing it.
I have people that are coming to me that are like, my depression's worse. I'm like, okay, what are you taking? And they tell me all these things. I'm like, you're speeding up the metabolism of your SSRI, your medication. So really the problem is you're taking a supplement that's harming you.
Yes.
And this could be potentially fatal. People can die from this. And this is not discussed and not talked about is influencers say everybody needs this. If you have no idea or don't understand the pharmacology or medication interactions behind it, it is not safe. It is not safe. So that's why I always say, go to someone who's reputable, who knows medication, knows pharmacology, but also knows the botanical medicine and the vitamins, and know how those things are going to be broken down in the body. Because this could be very dangerous. And people just throw it around.
No,
like,
that's so dangerous, especially because that same influencer that could be sharing her raw, real story about being medicated for depression is then being paid by a supplement company to push a supplement that she probably doesn't even use.
Right.
And it's like someone just looking and thinking like, oh, okay, well, cool, I'm going to do that too.
Yeah.
Or they're just talking about the supplement and you happen to be taking those things and you don't even realize the issues that it can cause.
Yeah. A majority of what I do is take people off of things. Or I hear, hey, should I be doing this parasite cleanse? I'm like, no. Like, let's not do that. Do we even know if you have a parasite? Are we just going to wipe your microbiome out?
It's so wild, like what we see on the internet.
It's scary.
It's so scary. I am obviously a proponent of quality supplementation where we are lacking, especially due to the area of the country that we live or where we can't get it nutritionally from food. Our food is less nutrient dense than it used to be. So there is definitely a space for supplementation. And so obviously like I have a collagen, I'm passionate about a couple, but like I don't really take a lot of supplements. I really try to get the majority of my nutrients and my fuel from real quality food. And I think so often it's become this billion-dollar industry where it's the next best thing to cure everything. And we're overdoing it.
It's essentially what is happening with supplements is what is happening with medication.
Yeah.
Here's a supplement to fix your problems.
Yeah.
What you're doing currently is getting a majority of your micronutrients, your everything out of your food. That's ideal. I tell people all the time, supplements should not be taken forever. I think that's the common misconception is I have to take this probiotic for the rest of my life. No, it's meant to help fix your problems and then move on with your life. So I think that there's a weird gray area where people are kind of abusing supplementation.
100%. And I think most often, again, like we said, and what I always say about collagen is at best, you're most likely taking something that's ineffective.
Right.
And at worst, you're taking something that could be toxic.
Right.
It's a gray area. To have someone recommend something that actually has done the research and the work, and to your point, understands the pharmacology of how things interact with the body,
Right.
is so critical.
So critical, especially nowadays where we're just flooded with health TikTok or health Instagram reels. And it's like, I just have to put my phone down.
I know.
I can't.
And like, don't forget, guys, as I always say, become uninfluenced, because people get paid to push this product to you.
100%.
So that is so important to remember whenever someone's selling something and it looks intriguing, is to go do your own research, because the intention behind why they want you to buy it is so important to understand.
Right. And I have patients that'll be like, hey, what about this supplement? I saw it come up. And sometimes I'll be like, yeah, that's a great brand.
Yeah.
Or, yeah, we can add that to your stack. It's not all the time where I am against supplementation online, but a majority of the time it's not right for people.
Yeah, agreed. And it's just like we said, just such a big area where it's for me, I love to hear the conversations now starting around food and regulation and trying to clean up ingredients. I think that's a step in the right direction. When it comes to supplements and beauty and skincare, we're actually going in the opposite direction.
Yep.
Completely. That's the trends that I see online. And it's everything from, everyone and their mom having a supplement to sell, to, kids with their 12-step skincare routine at age 12.
Right.
This is the opposite of what we're seeing and doing in food. And it is the same situations and the same concerns.
Right.
So it's like trying to educate and help people realize what you put in your body is so critical.
Absolutely. And a lot of these big brands like Nestle, they've bought out a lot of big supplement companies.
I know.
Which is scary, because then you have to look and see, okay, what's the quality like now?
Yes. Yep. Anything that's produced in such that higher mass production comes at a cost of quality so often.
Right.
Yeah. Who did they purchase? Garden of Life?
Pure encapsulations.
They purchased Pure
think.
Encapsulation.
Or Vital Nutrients. It's one of the two. One of the two. I
Same.
want to say it's Pure Encapsulations. The bottles are very similar, but
Yeah.
Yeah, they've purchased a couple.
I know Garden of Life as well, I believe. It's a shame. And that's why hopefully I can keep bringing some quality products to you guys in the future. Lifestyle shifts. Would you say that the majority of people that come to you, I heard this personally, I think on the side of when it comes to like eating clean and the products, I'm pretty ahead of the game. Where I've struggled a lot with over the years is stress. I think so often we don't realize that we could be doing like everything right on paper, but if we're living this high stress lifestyle, and it was when I was in corporate and then I kind of translated that into entrepreneurship, it's really the statistic that I saw was like, I don't know, over 95% of people who walk into a Western healthcare facility with a disease is caused by stress.
Yep.
And like, what are some of the things that you're recommending when it comes to people who are maybe their lifestyle outside of the physical diet can reduce stress?
One of the big things that I talk about is sleep. Because, I mean, we're
Number one biohack.
And it's like mind-blowing, right?
Yeah.
It's one of those things that we go all day long, and then we come home and we stare at screens, and we just are on the couch. We don't build relationships. We're not active for a majority of people. And then we hit the pillow and we expect our brain and our nervous system to quiet down. For a lot of people, if we have a day like that, it's not easy for the body to calm down. So I tell a lot of people, think about kids. Like, when you were a kid, your parents probably fed you dinner, read you a bedtime story, got you a bath. We did a specific routine in order for us to kind of settle down for the night.
Yeah.
But as adults, we don't do that. And that's where a lot of issues come in, is we don't get restorative sleep. And then the next day we just feel burnt out and exhausted. And that stress cycle just keeps continuing. And it's mind-blowing, but also very simple for people. Hey, let's start going to bed at the same time every day. I don't care if it's a weekend. I know you have stuff to do, but like, what's more important at this point in time? Your health, managing your stress, or maybe going out to a movie? What's more important at this point in time?
Totally. That's so simple, yet I would agree with you. So hard for people.
So hard.
I mean, I feel like a leper in this community because I have an early bedtime that I do not fuck with.
Listen, my husband and I are in bed by 8:30 and we get up at 4 and people are like, "You're
Yes.
28. You should be like," I'm like,
No.
"I'm happy with that. I'm in the gym early."
When I was just telling my friend this yesterday because last week I had this like little sinus thing going on,
Mhm.
and so I was not sleeping well and sleeping in later, and I was like, I got to get back to my routine because when I am up early, and
Mhm.
I've always been like a night owl my whole life, I've
Yeah.
really trained my body over the last year to be an early riser. I am a different person
It
when I get quality sleep
Yeah.
and I'm up early and my day starts at dawn.
Yeah, you feel so much more productive and you're like,
Yes.
"Everyone else is asleep."
Yes.
It truly is life-changing, and it does take training.
It
Trust
does.
me, it's hard sometimes,
Mm,
but you reap the benefits of it,
you
and you
really
don't have
do.
to do crazy things to get those easy results.
Yeah, exactly.
Yeah.
I think too the screens that you mentioned is
Mm.
so important because as we've continued to live in this technology driven world, I mean, the screens have become an addiction that
Mhm.
is a bigger pandemic for our society than some like alcohol and drugs.
That
It is a very similar brain dynamic.
Absolutely. It's how they have designed these apps to scroll up. It
Yes.
actually triggers your brain to release dopamine. So every time you're scrolling, your brain's getting a hit of dopamine.
Yes.
Same thing as if you would do drugs or eat something super comforting. And the notifications and how they pop up. It's
Mhm.
very scary how they've designed technology to suck you in.
Suck you in
Yeah.
completely. And then to think how you were mentioning, your brain doesn't have that time to turn off.
No.
And so even if you're like going to bed, it's like you're not getting that quality sleep because you don't even know it's night in your
Right,
brain.
right. Your brain is constantly filtering out noise, sound, and I hear a lot of people say, "Well, my husband sleeps with the TV on." Well, he can go sleep on the couch, or you
Yeah.
can go sleep on the couch wherever. Your brain is constantly filtering out that noise, that sound, that light, and you're never going to get restorative sleep if you're
Yeah.
having that outside distraction. So even
Yeah.
if you're asleep and your TV's on, it's still a problem. Yeah.
Restorative sleep, number one for stress. I
Yeah.
love that.
Yeah.
That makes a lot of
It's simple
sense.
stuff, but
Yeah, simple stuff. What do you do personally, like from a lifestyle standpoint, that is maybe your core pillars of living a healthy life and being able to then show up for your patients? I know you mentioned early
yes,
bedtime.
early bedtime. I am a very active person, thanks to my husband as well. He kind of keeps me going, but I am someone who's either in the gym. I am training for 2 half marathons right now. I
Wow.
That is something I enjoy. That's how I get steam out.
Yeah.
Because when you are sitting and kind of going through the emotions with your patients, at first when I was in practice, I would take on a lot of that. It would be hard for me to be like, okay, tomorrow's a new day. It's heavy.
Yeah.
So having that outside time, walking my dog, like doing the things that really fulfill me. I take dance classes. I do all this stuff to really help fill my bucket up.
Mm,
And spending time with my husband is one as well.
yeah.
So it's simple things, eating clean as I can. But yeah, really trying to find the time that will fill my bucket back up is
Yeah.
huge for me.
I love that. So many other, even if you're not in the healthcare profession, can relate to that because there are so many, especially as a service provider in general, of any
Yeah.
kind. I mean, you really are, we don't always realize energy as this currency. And I always say, like, the sixth sense that no one talks about
Mm.
is our energy levels and how we can be drained or depleted, or, depending on if we're giving or taking on, it's this kind of unmeasurable
Mhm.
dynamic that totally affects our well-being.
Yes.
And when you can incorporate things for your creativity or
Mhm.
that bring you happiness and joy, like a dance class or going to the gym,
Yeah.
it's so restorative in so many ways besides physical.
Absolutely. It's an exchange of energy, and
Yeah,
even if it's virtual, I still feel it from people.
that's
It's
so cool.
Yeah.
How do you like Cleveland?
I like Cleveland. I love especially this time of year.
I know.
I'm, like, always on the Metro Park trails and yeah,
The metro
it's
parks are amazing. That's actually interesting because when
Mhm.
I moved to California, there are some really beautiful areas
Mhm.
to, go and hike and spend time in. Joshua Tree, some like there's amazing spaces out
Mhm.
west. But when it comes to the access to normal trails
Yep.
in just any old town, even in Laguna Beach, like the coastline was amazing.
Mhm. Mhm.
But I'm like, I miss trees. And the city here keeps up our Metro Park trails so well. And
Yep.
it's like, as a woman, like
Mm.
single woman, I can go and hike with my dogs and it's safe. And it's such a gift.
Right. I've lived in New Jersey, Philly, Chicago, and really I'm like the outdoor how they keep it here is just so nice.
It's so nice.
People are so lovely here. Growing up
Oh
in
my
Philly,
gosh.
I'm like
Oh my
this
God, it's
East
a
Coast
different vibe.
mentality, it's a different vibe. People are just really sweet here. So I love the people.
There's no one like Midwest people.
Truly.
It is a real thing. Yeah, and I've spent a lot of time traveling in other areas, East, West Coast. It's just like
Mhm.
the people here.
Yeah.
You can't beat them.
You can't beat them. And I was raised by two Midwest parents, so
Yeah.
they instilled that in me. But
This is
still,
like your heart.
yeah.
Aw. Well, we're
Mhm.
so happy to have you here. You are such a gift to Cleveland, truly. And thank you for all the work that you do and the health that you're bringing. We need it here. Like we
Mhm.
said, the best people, honestly. And oftentimes in the Midwest, the most sick.
Yep.
So to have more and more access to true healers like yourself
Mhm.
is an incredible gift. So thank you. And we are going to do something special, which is so exciting. We are going to offer a code for anyone who wants to have a first time visit with Dr. Madison.
Mhm.
Code Cheeky.
Yep. Code cheeky. Yeah.
Yeah. CHEEKY.
Mhm.
Does it matter if it's lowercase or uppercase?
It doesn't matter. No.
Okay. We'll give you a free first visit.
Yes. Yeah. Typically it's a $40 appointment, but it'll give you
Oh,
free first appointment.
that's so badass.
Yes.
So anyone who's interested in learning more about functional medicine or what type of care Dr.
Mhm.
Madison could provide, or if you're feeling unheard by your current provider, or if you just want a preventative option,
Yeah,
come and have a first time visit.
Right. And just chat. I mean,
Yeah.
just learn more
See
about what
if
I
it can
do and
fit.
yeah, see if it can fit.
Really cool. Thank you for offering that.
Absolutely.
Code Cheeky. And yeah, thank you, Dr. Madison, for being here today.
Yes, I had so much fun.
You're such a pleasure. Thanks, girl. And where can everyone find you? What's your Instagram?
My Instagram is Dr. .MadisonLaGard.
Okay,
Yep.
Dr.
Yep.
LaGard.
And then you can also follow us at Great Lakes Health Ohio. That's our practice Instagram as well.
Perfect. So find her there.
Mhm.
We'll leave the code and some of the resources that we chatted about today in the show notes. As always, you can find me at The Cheeky Clean or go to thecheekyclean.com for more resources. Thank you.
Thank you for having me.
Thanks, guys.